Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman. I'm here bright and early with you all. I hope you're doing well and having a good weekend. We have lots to talk about today, so I'm going to start immediately. If you have questions, we're live. You can call us at 1-800-321-0710, 1-800-321-0710. It's Dr. Lederman, the Radiosurgery Hour, and we're talking about how to make your life better, get better treatment for cancer, live better, live safer, live longer, live healthier. So those are our goals of this program and the goals of our program and our life. First patient I want to talk about is good news, a good news story. It's a gentleman, he's a personal trainer, so he's got big muscles and he's healthy and he comes strutting in. He came to us a couple of years ago with prostate cancer, and he was shocked, of course, that he was a pretty young man, about 40, 45, and had prostate cancer. It's localized cancer. We talked about all the options. We talked about surgery, radiation, waiting. He chose to be treated. He didn't want surgery because he knew the complication rate was high with poor likelihood of sexual function and urinary function. He knew the complication rates. He didn't want someone's hands or knives in his pelvis. So at that time, his PSA was about 9. He was treated, and very quickly, without hormones or anything else, just pinpoint radiation, his PSA went down to 0.2, which is a fantastic, quick response. And then last week, he was shocked. He called me. His PSA went up to 0.8, and he was so concerned. And I was too, but not shocked because PSA can fluctuate. And he said, Doc, before I got that PSA, I had sex. Well, I told him, sex can elevate the PSA. And we repeated the PSA this week, got it back yesterday, Friday, and it's back down to 0.2. So he's in remission. He had radiation with us, pinpoint radiation. He's doing great. He's fully functional. He's sexually functional. He's got his urine controlled normally. He has no side effects, no bleeding, no pain. Doing great. And that's really the goal of our treatment, is to treat people so they live a normal life like any other person their age with a normal trajectory of lifespan. And someone like him is probably going to live another 40 years. So most likely his cancer will never come back. He's in remission. His sex life is good. His urinary life is perfect. He's happy. I'm happy. And it's a testimony of our treatment. So here's a personal trainer who is keeping his body together, not dissected up. So congratulations to you. A great PSA, great results, and keep it up. So here's another story. In a way, it's a kind of tale of two cities story. This is a man about 55 years old with lung cancer. He was diagnosed 2 years ago and treated. And I met him this past fall after he had had his head opened up by a neurosurgeon. He came into a hospital in New York. He had headaches. He had 2 tumors in his head. Now remember, he had the history of lung cancer. The neurosurgeon opened up his head, tried to remove one of the tumors, and left the other tumor in the head. So you can argue about why and what. I guess you could say the neurosurgeon wanted to prove what it was 2 years afterwards, although we would have diagnosed it by the MRI without the surgery, had the patient saw us first, had the patient sought a second opinion. But sometimes it's hard for patients to get out of that hospital complex. They go in and feel compelled to do whatever they're told. And so this man felt compelled to have that neurosurgery. And he had that neurosurgery last October. He then came to us for radiosurgery. Why? Because when you remove a tumor in the brain, like a metastasis, the cancer cells are almost never totally eliminated, and there's a high recurrence rate, number one. And number two, he had a second cancer, which was left in the brain. So there are the two cities. One area where the cancer was attempted to be removed, one area where there was no attempt, sent to us, and we treated both areas. So now the patient, 6 months out, doing great, fully functional, except the surgical wound had never healed. The man, about 55, has diabetes. The wound never healed. He saw his neurosurgeon this week, and the neurosurgeon told him he's got to go to a plastic surgeon. And didn't really explain why the heck he has to go to a plastic surgeon. And then he came to me not understanding why, and this is a very intelligent man and a very intelligent wife, but they were never told why they're going. And they went to the plastic surgeon, and they were never told why they're there either. So they came to me, and I became the messenger. So I called the plastic surgeon and called the neurosurgeon, and it became obvious that the screws where his head was put back together were now exposed. The skin was not closed. The wound did not close. And they were going to have to repeat that whole surgery, remove all the screws and plates, open up the wound, replace it all, and then bring skin in from another part of his body to close the wound because there wasn't enough skin on the scalp to close the wound. So, wow, what a difference two different approaches make. Our tumor that we treated without surgery is doing fine. The other tumor is doing fine too. But with us, there's no cutting, no bleeding. And when you can stay out of the hospital and stay out of surgery and stay out of cutting and infection and complications, usually you're a lot better off. So this man, we sent him back to get staged up with a new MRI and a new PET scan to make sure everything is perfect. And then he's going to decide what to do. But he's got this wound from surgery that just won't close, even though from a cancer point of view, he's doing very well. So the lesson of it is most people have a chance to get a second opinion. Usually it's not such an emergency. And it's often better to say, let's hold on, doc. I just want to get a second opinion. Maybe even call us and learn about the possibility of other options besides just the one that you might feel is being pushed upon you. And you may wish to consider non-invasive treatment compared to invasive treatment. Nowadays, a lot of treatments are becoming less and less invasive as technology marches on. That's the whole point of radiosurgery. Why do we call it radiosurgery? Well, instead of surgery with a knife, we do surgery with a little radiation beam, a pencil-thin beam, to hit the cancer. And it may be a lot more appealing to come in and get a treatment for 15 minutes and walk out and have lunch or go to work or meet your family for a movie or Broadway play than to be in the hospital. So that's what we do. And we don't always advocate it, But we talk about choices, and that's why our telephone number is 212-CHOICES, because we believe that most people do have choices. And if your cancer treatment isn't working or isn't tolerated, you may want to call 212-CHOICES and see what your choices are, because it's very likely you have other choices. 212-CHOICES. And there's another case, almost the same idea from the opposite coast. It's a family who called from Los Angeles, heard about us. The wife called. The patient's a 30-year-old man, her husband, from Northern California. He presented with acoustic neuroma. Acoustic neuroma is a benign tumor of the brain, actually of the nerve that goes from the brainstem to the ear. It's responsible for hearing and balance. He had some hearing changes and some balance changes. He went to a hospital. They said, you have a tumor, you have to have surgery, and they operated on him. He was left deaf. He was left with facial paralysis. And he was left with residual tumor 6 months ago. So you've taken a 30-year-old musician, made him deaf in that ear, facial paralysis, so it's hard to have a normal social life, and there's residual tumor. And now that residual tumor is growing, and he's told again by the surgeon he needs surgery ASAP. And the family feels it's a disaster. They ran after the surgery the first time, deformed him. He'll never get his hearing back there. Now that residual tumor is growing, so it failed to remove the tumor, and it failed to keep his quality of life. Compared to our treatment for acoustic neuromas, and we have the world's largest experience treating acoustic neuromas with fractionated stereotactic brain radiosurgery, which is pinpoint treatment, non-invasive, no cutting, no bleeding. We were the first in New York to perform brain radiosurgery. We've treated more than 1,000 patients with acoustic neuromas. Our success rate is 97%. The vast majority of our patients keep their hearing to some degree. Most have stable or better hearing. A few have less good hearing. The likelihood of facial paralysis is near zero with us. The likelihood of regrowth of the tumor is very small, 3%. And if this man came to us, unlike surgery, where for a 3-centimeter tumor, you're guaranteed to be deaf after surgery, with us, most likely he would have kept his hearing and his face, and most likely he would have been in remission. So yes, get a second opinion. Don't rush in. Acoustic neuromas, most tumors are not emergencies. Take your time, take a breath, give us a call, 212-CHOICES, and learn about your treatment options before. So for this family, they're planning to come now to us to treat this residual tumor because surgery failed them. Surgery caused these terrible complications. I only wish they knew about us 6 months ago, and I think they wish, too, they knew about us 6 months ago. So these are lessons for all of us, and we can all learn. If we learn from others, sometimes life will be less painful for ourselves. Now we're going to stop for a break. We have some new voices, not necessarily the platinum voice, but some new voices. We're live here at WOR. We have Bob and Ed in the studio running this whole place and ready to take your calls. They're at 1-800-321-0710. 1-800-321-0710 if you have questions. And we'll be back in a moment.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD called 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurance